Good morning. My name's Ian Tucker, and I'm a paediatric endocrine bone clinical nurse specialist. I wouldn't recommend saying that several times over. Um, and I work at Bristol Royal Hospital for Children, and I'd like to thank the organisers of the Brittle Bone Society for the opportunity today to talk to you. And I'm talking to you in the context of the Rare Bone Nurses Network for the United Kingdom and Ireland, which I'm going to expand on. And I think we're doing it in the context of how it's successful something has been in osteogenesis imperfecta, and seeing if we can use that as a platform to roll out. And it's very hard to get anything like this going when you've got people spread over a long kind of geographical location. But what we are is a group of nurses, predominantly at the moment, who work in the field of bone health in children. And what we decided was we very much were all silo working and did sometimes in very disease specific models, and we wanted to try and use the experience that is available, which is limited because there's very few of us, and a lot of these new conditions are coming to the fore when pharmacological treatments become available. And we wanted to capture some of that data and also share it so we can maximize the opportunity for us to learn from each other, and then use that as a platform to kind of further what we can do for patients. So again, we're in our infancy. Uh, a couple of conditions to name would be X-linked hypophosphatemia, um, and the Alexion treatment for hypophosphatasia kind of gave rise to the need for bone nurses like myself to become a little bit more versed in some of these very rare conditions. And then that leads to the fact that if we're going to become involved with patients, we kind of need to know what we're talking about, which does help. And then as you roll these things out, we can learn a lot from the process. And again, using that, we can share what we've learned and what went well, what didn't go well. And as we expand our knowledge base, we can try and share that with other people to kind of help other people along that pathway if they're slightly behind us. And we know there's gaps in the information for some of these rare conditions which have had very little attention over a period of time. And we wanted to kind of consolidate the approach to treatment because there is quite a lot of variance in that. And as I said before, some nurses are spread over a multitude of specialities. Now, I work in endocrine. I know my colleague in Great Street who deals with osteogenesis imperfecta. He does that condition on its own. And then you've got people in Sheffield who work across the spectrum of metabolic bone. So people kind of come at it from different angles. So when we go to our meetings, they tend to be an endocrine meeting, they tend to be a bone meeting, they tend to be, they could be, people can be coming from multitude of different areas and never come to the same actual place. So we're trying to redress that, and that's the kind of principle of what we're trying to achieve. So what model are we using? So hence why I'm sitting and Patricia phoned me to talk to you about it. It's because I know Patricia through my brittle bone kind of provision in Bristol. We're one of the national centres, and one of the things that when the commissioners set it up, they wanted a national team, and they're very keen for a national collaboration across the board, and that includes therapists and nurses as well as the medical side of things. But what they set up as a standalone model was that the therapists and nurses would get together several times a year and discuss their challenges, their research, their developments and successes, again to kind of streamline processes, to make things easier, to share information, what went well, went down. And it's been a very, very positive aspect of that part of the service. We've presented at international conferences, we've done collaborative work, we've done collaborative research, and it has been very successful. So I suppose that's exactly what we were aiming to achieve with the Rare Bone Nurses Network, to try and get the same kind of parity with some of the other rare conditions. Some of the conditions I've mentioned before. So I have to be honest, X-linked hypophosphatemia is a condition that I saw patients in clinic, didn't take very much notice on, or have very little to do with them because it was very medically led. All of a sudden, the new treatment came along, and it was like, whoa, I was kind of pushed into the fore, had to learn very quickly. But from that, I got a great deal of knowledge in a very quick space of time. We developed a lot of tools, lots of information. I did a nurse-led service to get the kids or patients started on treatment. And what we realized quickly is other people around the country were doing that at different time points. And what we could do is share a lot of the information, not reinvent the wheel, and give a lot of this practice, what went well, what didn't, to these people. I generated a lot of documents, for example, which were shared far and wide, and it saved people time, but also made it easier for us to know that we're all doing roughly the same thing and helped guide us to be doing the same thing. And from that, we get more meaningful information back about how things go. Um, Identified very quickly there's a very big thirst for knowledge, and we all, as nurses, wanted to improve the patient experience. Ultimately, the patient's what we're here for. Without, if we wouldn't be doing our jobs if we didn't want to improve what we do for our patients. And I think that's how, through the back of some very kind pharma funding from Kira Kurin, to kind of get the group kind of initiated, which we are still initiating, made it happen. So, and I think the platform from these new conditions, not, well, they're not new, but these conditions and the funding that came from the treatments has helped. And we know achondroplasia, there are 4 companies vying for a treatment, and there's a lot of research being done at the moment. So again, it's a platform from which we can share this knowledge and skill. So this is one of our very first meetings where we met up with XLH UK and the group of nurses. And the reason we did it that way round, and I think it's a great way to approach these things, is first of all, what information is there? What do the patients films missing? And the only way we can do that is to speak to the charities who have that membership, who can tell us. We have a habit sometimes in medicine of assuming what patients need and often getting it a little bit wrong. And so I think the beauty of being a nursing collaborative, where we can invite people to come and talk to us about what their patients feels missing, and where we can help. And don't forget, by engaging people who work in places like osteogenesis imperfecta, I bet there's a lot of parity across the spectrum of problems which have already been sorted in a different condition, which again, use that experience in the room. And again, this is a picture from one of our very first meetings. We are all smiling now because it's very productive. So our aim is to formalize our own setup. We're going to try and use the British Paediatric and Adolescent Bone Group as an opportunity to meet alongside our consultant colleagues. It means we get the education in the afternoon, but we get to meet it standalone. I think from a purely selfish point of view, if our consultants are actually in a meeting, they're not in clinic, which means we're often more free to attend. So that works very well. We want to expand this group. I think we have to get it up and running and sorted and get our structures and everything in place. But we want to kind of open this out to other allied healthcare professionals and therapists, etc., to kind of really reflect the diversity of professionals involved in the care of these children. So hopefully that gives you a bit of a background into what the UK, United Kingdom Rare Bone Nurses Network, UK and Ireland, is aiming to do. I won't say we're doing it, but that's what we're aiming to do. And hopefully I'll be able to come to you in a few years' time and update you and say, yes, it's been successful and we've rolled out more information in different conditions. So hopefully it's an evolving picture, which will be a very positive one. I'm not going to pretend that COVID hasn't really made it challenging, because we were just getting going and that stopped. And as you can imagine, everybody's incredibly busy, and I think certain meetings are not really on everybody's agenda at this precise moment in time, but it's not something that we wish to stall with and hope to get going soon. I do thank you for your attention. I know this is a Brittle Bone Society day today, but hopefully it gives you an idea of what some of the things that have come in from the OI community and some of the successes that have come in from the OI community will hopefully go on to help other people in other conditions. And I'll say thank you for listening, and hope the rest of the meeting goes well.